Welcome to our CTSNet Roundtable. My name is Jessica Luc, and I am a resident editor of CTSNet and cardiovascular surgery resident at the University of British Columbia in Vancouver, Canada. With our recent launch of the 6th annual CTSNet Resident Video Competition, I am so delighted to be joined today with past winners of the competition to talk about submitting a video to the CTSNet Resident Video Competition, how to do it, and why. Can you all please introduce yourselves?
Hi, everyone. My name is Brian Mitzman. I am a thoracic surgeon at the University of Utah, and I was the 2017 winner when I was a fellow at the University of Chicago.
Hi, everyone. My name is Nestor Clusa. Actually, I'm the chief resident of cardiovascular surgery at the Cardiovascular Institute of Buenos Aires, and I have won the CTS Resident Video Competition in 2019 when I was a third-year trainee resident.
Hi, I'm Harrington. I'm currently a fourth-year general surgery resident at Oregon Health and Science University and a research fellow at Memorial Sloan Kettering in New York City in thoracic surgery. And I won the competition in 2016 when I was a fourth-year medical student at OHSU.
Hi, everyone. My name is Awais Ashfaq. I was the winner of the 2019 video competition. That time, I was the congenital fellow at Cincinnati Children's, and right now I'm in transition mode, and soon I'll be joining Johns Hopkins Children's Hospital in Florida.
Excellent. Well, welcome everyone. Thank you so much for joining us today. So kicking off the video, it is meant to be an informal discussion with you all experts on this topic to highlight the process, how they went about creating videos for this winning submission. We will start the conversation off with a question for everyone. Can you share with us in brief what video you all submitted to the competition?
Sure. I guess I'll start it off. So my video in 2017 was anastomotic techniques for robotic beating heart totally endoscopic coronary artery bypass. And while I am a general thoracic surgeon, back then as a fellow, I was working quite a bit with Sam Bulk at the University of Chicago. And this was a pretty unique case that we thought would be, really beneficial to share with our community and great for this competition.
I continue. The video I submitted in 2018 was a two-stage hybrid approach for type 1 aortic dissection, replacing the ascending aorta and the aortic arch with an elephant trunk technique in the first stage and an endovascular treatment of the descending aorta as a second stage.
My video was entitled McEwen esophagectomy, and it was just a how-to of how the surgeons at OHSU perform the operation.
So our video in 2019 was entitled Double Switch Operation, which involved Senning and Rastelli. And this was a patient who had, in addition to a lot of other congenital defects, which are rare to begin with, also had atrioventricular and ventricular arterial discordance. And we thought that collection of all these rare defects in combination with the procedure, which is not performed so routinely nowadays, would be a good way to at least record and then share it with other community members.
That's phenomenal. Thank you so much, everyone, for sharing with us. It totally ranges from general thoracic surgery all the way to adult cardiac as well as congenital. So it truly demonstrates the diversity of our specialty in cardiothoracic surgery. And moving on to talk about the tools used in this process, can you all tell us what the process was in obtaining and editing the video and any tools that you had used in this process?
I think it's pretty straightforward for most robotic and VATS videos nowadays. Most hospitals have systems set up to record off of the camera pretty easily. For the robot at the University of Chicago, it recorded right into a system automatically that you could download any video off of. And then when it comes to editing, I've been submitting videos for years, back since I was a resident. And at this point, I use Final Cut Pro, which is, it's advanced video software, but it's really great for editing your videos, keeping quality pretty high, and even putting little, animations and highlights into the video. So I highly recommend that.
Thank you, Dr. Mitzman. How about you, Dr. Clusa?
As already Ryan said, I think the most important step in video edition is recording the surgery. At our institution, we try to record every surgery that might be interesting or challenging, and we have our own video library. That's very important. I think the most important step is this, and it's important to encourage surgery residents to get used to recording surgery because it's a really valuable tool for learning and for teaching. And regarding edition, as Brian said, there are lots of software available for video edition. Some of them are more complex than others. I don't think you need to be an expert in video edition to do this. It's just practice. The more you do, the easier it becomes.
Thank you, Dr. Clusa. And what specific technology did you use to record your video? I know that it can be a bit more challenging with, for example, open surgery.
At our institution, we use a 10mm full HD endo camera connected to a video recorder, the same camera you use for thoracoscopic surgeries. And we also have a roof camera in the OR to take more panoramic pictures of the surgery.
Phenomenal, thank you. And how about you, Dr. Harrington? What did you use to record your video and edit it?
At OHSU, there's first of all, the entire operation was either thoracoscopic or laparoscopic. And then the neck dissection, I think an HD camera was used for that portion of the operation. And then that just files right into a video system that you can go and log into and then download all the videos that were recorded.
That's phenomenal. And what did you use to edit your video?
Well, I had no budget because I was a medical student. So I actually just used the free Windows Movie Maker that I could download off the internet, which I think it was clunky as a program because I couldn't pin the sound to the video clips. So anytime I edited a clip, I had to redo the sound. So it was not efficient, I would say. So getting a good program that maybe would allow you to do that would save a lot of time. But I think it's a good point to make that if you don't need fancy programming or equipment or anything to try to make a video and enter it into the competition. So people should go for it.
Thank you for your tips, Dr. Harrington. And how about you, Dr. Ashfaq? What did you use to record your video and edit it?
The recording software we use is a headcam. It's a BFW headcam. It's again, it's the same, on the same lines, an HD camera, high def technology, and we all wear it. And so we just rely on it, and both of the person, the surgeon and the first assistant, their video gets recorded. And so you can view it in different, basically in different views per se. And then usually all of this goes into very similar to how Dr. Clusa mentioned. They all go into a video library that the institution has, and then we pick and choose whatever we want to edit for either our own learning purpose or for distribution purposes. And the software is very similar to how Brian mentioned or Dr. Mitzman mentioned, TrueCut Pro. And there are different versions of these softwares which you can use. And I think they're pretty, once you get a hang of it, it's not that difficult to really edit and make it annotated in a way that people can understand. Yeah.
Phenomenal. Thank you so much. And a question for everyone. What did you learn in the process of applying for this competition? We'll start off with Dr. Mitzman.
Sure. So, I've learned a lot even since I applied and won. And what I've seen is it doesn't have to be the most complex video that you need to submit. Sometimes something that's very straightforward, that's just explained really well and edited together nicely, is a great video to submit here. For example, while it wasn't part of the competition, the most viewed video on CTSNet for a couple years now has been Technique for Chest Tube Insertion by Shanda Blackman and Aaron Gillespie. And considering all the material we have on the website, you wouldn't think that that'd be the most popular video, but it is. So, I say record everything that you do, and, again, doesn't have to be the most complex thing. What would be the most useful for our community to see?
Very insightful. Thank you, Dr. Mitzman. And how about you, Dr. Clusa?
First of all, I learned a lot by watching all the previous videos from the 2017 competition and see what types of video were published and the presentation format. And with my video specifically, during the making, I learned how to summarize a 7 to 8 hour surgery into a 6-minute video. I have learned how to highlight the important things to be shown so that a really complex surgery becomes understandable for everyone, mainly for trainees.
Phenomenal, thank you. I'm sure the summarizing process really helps with ingraining in yourself the steps to the operation, and also enhances the teachability of an operation to others. And how about you, Dr. Harrington?
At that particular point in time, because I was a fourth-year medical student, making a video about all the steps of a very long and complicated operation was an exciting but challenging task, because I hadn't actually seen all the portions of, I'd seen a lot of the thoracoscopic portion, but I hadn't been a part of the laparoscopic portion actually yet. So I am saying this again because I would like to encourage medical students or early trainees, like interns or younger residents, to challenge themselves and kind of go outside of the box. And you can learn a lot. I learned a lot about that operation, the steps of the operation, and tips and tricks from sitting down with Dr. Hunter and the thoracic surgeons at OHSU and talking about their advice so I could make the video the best it could be. And then obviously learning how to distill a very long operation into a short video was a challenge, but it was a good one.
Incredibly inspiring to have submitted a video and won the competition at the level of a medical student.
Thank you.
And how about you, Dr. Ashfaq?
To be honest, so as I mentioned earlier, we record almost all cases, and for me personally, we have been recording cases during my training. I find it very helpful to go back and look at myself and see what we did, and if you do a case again, you know where you were slow or where you think you could have been better, and so on and so forth, which I think is another kind of valuable tool for your learning. But for this video per se, just because of how rare it was, we wanted to share it to the community, and we basically submitted it, and then we were recommended to resubmit it into the resident competition. And so that's how it happened. And we were surprised, honestly, that it would win it, but it did.
That's awesome. Your comment reminds me of Dr. Tyrone David's talk at one of the AATS meetings, where he got the opportunity to review one of his operative videos back in the day, and seeing where the steps of his operation and where people are losing time or inefficient steps, and you're able to pick out the parts of the operation where you could eliminate inefficient steps and become a more efficient and better surgeon. So that's a great comment. And great.
To be honest, sometimes you go back and you look at your videos and you just realize that, you watching yourself when you're doing it is so painful, how the surgeon who's taking you through a case, how painful it can be for them. So you really appreciate them more, I think.
Exactly. That's awesome. And in the era of increasing digital technology and virtual learning, what are all your views on utilizing surgical videos such as those on CTSNet for educational purposes as trainees?
Sure. So briefly with something that Dr. Ashfaq said, I agree, record everything. In our current era, there is no excuse not to record every single case that you're doing in the OR, especially if it's minimally invasive robotic or VATS or whatnot. It really is just, you hit one button. And as we talked about, it serves two purposes. One, you never know what you're going to catch. That could be a great video to be submitted for a competition or just to the website or a conference. And two, it's game tape. Anyone that's been an athlete knows the only way to get better is to go back, look at your game tape, and, see where you can improve. When it comes to actually, looking at videos for our trainees and for other educational purposes, I think it's one of the best ways to learn now. You know, you go into cases and it's one thing to look in a surgical atlas and look at pictures, but if you could go online, you know, if you're about to do your first robotic right upper lobectomy and watch a couple of videos, you know, from Surf or Dr. Delusky or, you know, Dr. Lazaro, and, you know, see how the masters do it, there's no better way to prepare.
I can certainly attest that I'm one of those people who spent hours looking over the mammary takedown operation on CTSNet before attempting my first one. So it's certainly a bank of resources to be utilized for trainees. And how about you, Dr. Clusa?
I think that nowadays everyone has free access to virtual learning. You can even do it from your cell phone. In this new multimedia era, as Brian just said, the best way to learn surgery is by watching an experienced surgeon maybe doing the surgery and explaining how it does it live, sharing his tips and tricks for specific procedures. I'm not saying we should stop reading papers, but regarding surgical technique, the video format is more enriching and dynamic way of learning than reading a paper with drawings, I think.
Phenomenal. And how about you, Dr. Harrington?
I found it to be, and continue to find it to be, valuable from the resident perspective, where you get to go and watch videos and get exposure to steps of a case before going into a case. I actually find that a high quality video I can learn a lot more from than just reading it, obviously, because you're looking at the anatomy and as you're going through it. And so, yeah, I think it's an incredible tool for residents and for medical students alike. And that kind of harkens back to what was said earlier about how the most frequently watched video, or most common video that was watched, was the chest tube insertion. So I think it's a great resource. And I certainly, when I rotate back on the esophagectomy service at OHSU, remind myself of things by watching the video I made. So it's a great tool.
Awesome. And how about you, Dr. Ashfaq?
That I would basically echo what everyone else has said. And, you know, not just, I mean, videos nowadays, I think it's not just a way of learning, but how you can see what other people around the world are doing. And you can, you know, see same surgeries that have been done in your institution before you, so that you're prepared. I mean, when we were interns, you know, we used to get reminded, and still do, the people who were before us, we used to, after every case, used to sit down and write down each and everything about the case, about what they did or what the surgeon did, and so they could go back and refresh and learn from it. But now I think if you're recording every case, you can really cut down the time that you're spending on taking notes. You still have to take some notes, but I don't think it has to be that detailed, because a lot of information is in that video. And you can remind yourself looking back and going through that video to see what really happened during the case. So I think it's a great tool, and I think everyone should use it as much as they can.
Phenomenal. And for everyone, any closing thoughts or words of advice to all the trainees out there thinking of submitting a video to the CTSNet Resident Video Competition?
Yeah, so I have two closing thoughts. The first one is more to the attending surgeons out there. You know, we've gotten very good about showing our slam dunks and our all-star cases in these videos, but don't forget to show your mistakes. You know, it's extremely educational for not only trainees, but other attending surgeons to see how you get out of bleeding, to see how you get out of a tough situation. You know, show us what you do. And then for all the trainees, submit your videos. Even if you don't win, you know, you get to be on CTSNet, you get your name out there. It's a good experience for you to go through the video and to edit. And hey, you never know, maybe you'll be on this video next year.
Awesome. And Dr. Clusa?
I think the takeaway message for surgery trainees is that they should get familiar with video and interactive learning, encourage them to make their own videos, get used to record interesting surgeries, and to have your own video library that will be useful whenever you have to make a presentation. And also to people who doesn't speak English as a first language as me, I think language shouldn't be an impediment. You don't have to have a perfect accent as long as you can transmit an understandable message.
Awesome.
And you get bonus points for having an interesting accent in your narration.
Exactly. And Dr. Harrington?
I think the takeaway is just don't be intimidated, especially for younger trainees. Don't be intimidated to try out making a video. You learn so much from it. And it's really fun to do it as well. And it's, I would say, a different type of project than, you know, doing a research project, for example, but it's something you can do in your own time in the background of whatever you're doing if you're in medical school or in residency. And so, yeah, just give it a try. Go for it.
And it is a skill to be able to consolidate and edit videos and make them look good.
It is.
And how about Dr. Ashfaq?
Very similar to, I mean, everyone else said. I think it's one of the important keys is to have a library. Either you keep saving videos that you have acquired through your training, and then you keep adding them as you practice, and just keep looking back at them. And, you know, 5 years into your practice, 10 years into your practice, and you will realize how much you've improved. And I think there's no other way that you can reproduce that from. You can look at videos from 10 surgeons, and you may get the opportunity to just operate with a couple of them. And so I think it's as much as you can learn, it's great.
Awesome. Well, thank you so much, everyone, for joining us for this CTSNet Roundtable. And make sure to submit your video to the 6th Annual Resident Video Competition. The deadline is December 1st, 2020, and this is open to all trainees, no matter what stage of career you are at. For more information and videos related to cardiothoracic surgery, make sure to check out the CTSNet webpage, and we look forward to your submission. Thank you so much, everyone, for joining us today.
Thank you.
Thanks, Jessica. Good luck, everyone.
Good luck. Thank you.